So guys, welcome again to Impact Made. My name is Dominic, and today we are going to learn vasectomy as a method of family planning. If you haven't subscribed to my channel, please subscribe and also get to learn. And if you haven't watched the other videos on family planning methods, please subscribe and watch them. So what is vasectomy? So vasectomy is a permanent contraception for men who will not want more children. Actually, as you can see, the difference between this vasectomy and the other family planning methods, this one is done to men, the other ones are done to women. So how is it done? It is done through a puncture or a small incision into the scrotum. The provider locates each of the two tubes that carry sperm to the penis. So vas deferens and cuts or blocks it by cutting and tying it close or by applying heat or electricity. So basically this one is works by cutting the tubes that carries the sperm to the penis. It is also called male sterilization and male surgical contraception. So it basically works by closing off each vas deferens, so it keeping the sperm out of the semen. So semen is ejaculated, but it cannot cause pregnancy. So vasectomy, since vasectomy is permanent, it is intended to provide lifelong, permanent and very effective protection against pregnancy. It also reversal is usually not possible. So once vasectomy is done, it cannot be reversed. It involves a safe and simple surgical procedure. A 3-month delay in taking effect. So as you can see, there is a 3-month delay in taking effect. So the man or couple must use condoms or another contraceptive method for 3 months after the vasectomy. So also it does not affect male sexual performance. It is one of the most effective methods, but it carries a small risk of failure. So what is the reason that some men will like vasectomy? So the reason is it is safe, permanent and convenient. It has fewer side effects and complications than many methods for women. The man takes responsibility for contraception, and it takes burden off the women. As you can see, it is done to men rather than the women, as you have seen the other methods. So, and also it increases enjoyment and frequency of sex, because you don't have to worry about pregnancy. Okay, now let's correct misunderstandings about the vasectomy. So it does not remove the testicles. In vasectomy, the tubes carrying the sperm from the testicles are blocked, but the testicles remain in place. So, and also it does not decrease sex drive, and it does not affect sexual function. A man's erection is as hard, it lasts as long, and he ejaculates the same as before. So as you can see, it does not affect sexual function at all. Does not cause a man to grow fat or become weak, less masculine or less productive. It does not cause any diseases later in life. As you can see, it does not prevent transmission of sexual transmitted infection, including HIV. So it does not prevent the sexually transmitted infections. So that's all about vasectomy. Thank you for watching, but today we get to learn another method of contraception. So let's go to it. So another method of contraception that is mostly used are the male condoms. So the male condoms, they help protect against sexual transmitted infections, including HIV. Condoms are the only contraceptive method that can protect against both pregnancy and sexual transmitted infections, as you can see. So it's the only method that can protect both the pregnancy and sexual transmitted infections, and also it requires both male and females partner cooperation. You have to talk with your partner decide. So talking about condom use before sex can improve the chances one will be used. It may dull the sensation of sex before some men, as we can see. As we can see, it may dull the sensation of sex for some men, but discussion between partners sometimes can help overcome the objection. How effective it is. So effectiveness depends on the user. Risk of pregnancy or sexual transmitted infection is greatest when condoms are not used with every act of sex. And also, so pregnancy is rare unless very few pregnancies or infections occur due to incorrect use or slips or breaks. So pregnancies is rare unless you do not use it correctly, or there's slips or there's break. So the health benefits of condoms is that it help protect against risk of pregnancy, STIs including HIV. It may help protect against conditions caused by STIs. So recurring pelvic also it protects against recurring pelvic inflammatory disease and chronic pelvic pain, cervical cancer, infertility, male and female, for both male and female. Those are health risks which are very rare. So it causes severe allergic reaction among people with the latex allergy. So, but again, it's rare. The reasons that most men and women prefer condoms is that they have no hormonal side effects, can be used as temporary or backup method, can be used without seeing a healthcare provider, and are sold in many places and generally easy to obtain. So condoms can be obtained very easily. They help protect against both pregnancy and STIs including HIV. Let's correct misunderstandings about condoms. So the male condoms do not make men sterile, impotent or weak. They do not decrease men's sex drive. They cannot get lost in the woman's body, and they do not have holes that HIV can pass through. So unless they break during the act. Also, they are not laced with HIV, as many people believe. They do not cause illness in women. In a woman because they prevent semen or sperm from entering her body. They do not cause illness in men because sperm backs up, so they do not cause any illness. They are used by married couples. They are not only for use outside of marriage. So it's not only to be used by outside marriage, it can be also used by marriage couples. We also have female condoms. So they require correct use with every act of sex for greatest effectiveness. A woman can initiate female condom use, but the method requires her partner's cooperation. Okay, so you have to talk to your partner to decide. May require some practice inserting and removing the female condom from the vagina, because it is easier with the experience. So you have to be trained on how to inserting the female condoms. So how is it effective? So effectiveness depends on the user. Risk of pregnancy or sexual transmitted infection is greatest when female condoms are not used with every act of sex. Few pregnancies or infections occur due to incorrect use, slips or breaks. So there are few pregnancies that may occur, but it's due to incorrect use, slips or breaks. So thank you guys for watching. I think we have completed our last method of contraception, and please subscribe to my channel to learn more healthy tips and more healthy topics that we are going to discuss. Subscribe and hit that notification bell to get notified whenever I post any video. See you next time.